If you run the administrative side of a medical practice, you already know the daily reality. It is exhausting. You are caught in a continuous cycle of hiring, training, managing, and then ultimately replacing your front desk staff at a pace that cannot be sustained. This graphic shows where your team's hours go. Right now, your front desk staff are losing 30 to 40% of their entire day strictly to manual administrative tasks. This administrative overload is an invisible drain. It siphons the financial lifeblood from your practice, often before you can calculate the exact cost of the loss. The healthcare staffing crisis remains severe. In 2025, medical assistants are the single hardest role to recruit. The average annual healthcare turnover rate has reached 22.7%, costing the industry $4.6 billion in burnout expenses. Replacing one front office employee costs independent practices $4,000 to $7,000 in recruiting, onboarding, and lost productivity. When staff leave, the remaining team absorbs an expanding workload. According to the American Medical Association, an average practice now handles 39 prior authorization requests every single week. Those requests alone consume 13 hours of physician and staff time each week, more than a full working day lost to paperwork. Then there is the final point of revenue leakage. Missed appointments cost the U.S. healthcare system $150 billion annually, which translates to a direct $200 penalty per physician for every single no-show. Industry analysts call this the staffing spiral. When generalist staff are pushed beyond their systemic capacity, constant turnover and revenue loss become mathematical certainties. To solve this capacity problem, smart practices are abandoning the outdated generalist front desk model. Today, 73% of healthcare organizations use some form of virtual staffing to manage their patient coordination and billing tasks. Many of these practices partner with Staffingly. They are a dedicated offshore virtual medical assistant provider serving over 800 healthcare providers with a proven track record. A virtual medical assistant, or VMA, provides dedicated, specialized support. They integrate directly into your existing electronic health record system within 48 to 72 hours. The implementation framework starts with discovery and EHR setup, focusing on immediate technical integration into the software your practice already uses. Next is team training. This aligns the remote team with your practice's specific protocols and insurance workflows. From there, the team initiates daily admin and scheduling coverage, followed by establishing structured weekly reporting dashboards to ensure absolute accountability. Staffingly layers AI automation over the human workflow, matching incoming tasks to the best specialist for the job. The AI uses machine learning to forecast workload and anticipate volume spikes before they happen, ensuring your practice stays ahead of patient demand. By combining a dedicated human workflow with AI oversight, you eliminate the constant need to retrain staff, creating a front office system that scales without burning out its components. This breaks down the financial reality of an in-house hire. Accounting for benefits, payroll taxes, and turnover, a local medical assistant costs $60,800 per year. Contrast that with one dedicated Staffingly VMA covering 45 hours per week. That costs exactly $21,600 per year. The math is straightforward. That is a direct annual savings of $39,200 per VMA. It is a permanent, mathematically proven economic correction for your practice's bottom line. Practices relying on the traditional in-house model repeat the same exhausting cycle of turnover, burnout, and lost revenue. A modern, specialized medical practice relies on a superior operating system that provides absolute predictability and peace of mind. Break the staffing spiral for good. Start your 30-day free trial with Staffingly today by visiting staffingly.com/demo or call 800-489-5877 to get started.